Hey, you guys. Welcome back for another week of practice questions. This week we'll do 3 questions and work through them. And then I'll go over the answers after giving you a little bit to answer those. So let's get into these questions. All right, this one states Miss Knox is diagnosed with osteoporosis and the nurse practitioner started her on Fosamax. What instructions should the nurse practitioner give? You know my rules. I always tell y'all to read the stem of the question first. So the stem of the question states, what instructions should the nurse practitioner give? All right, I'll give you a few. Let y'all read through those answer choices and see which one you would select. Okay, so again, stem of the question states, what instructions should the nurse practitioner give? So what are we dealing with? Ms. Knox was diagnosed with osteoporosis. The NPS started her on Fosamax. So what instructions do we give for Fosamax? All right. Is it A, be sure to take at bedtime? B, take on an empty stomach and do not lie down for 30 minutes? C, take with a meal? Or D, take with other scheduled medications? All right. So what do we know about Fosamax? Fosamax is a bisphosphonate, and this is something that we commonly treat osteoporosis with, but you really need to be familiar with those drug classes. The bisphosphonate class ends in dronate. Most of the medications, the alternate med, is DRONATE. So look for those because typically on the exam, it'll give both med names. But the bisphosphonate class, you want to make sure. So this answer choice would be B because you want to make sure you tell them to take it on an empty stomach and not to lie down for 30 minutes. Reason being, common side effects are GI upset and esophageal irritation, right? So we want them to take this on an empty stomach, tell them to drink a full glass of water behind it, don't eat anything else, and don't lie down, don't sit down for 30 minutes. So commonly you'll hear providers tell the patient, just take a 30-minute walk so that you're sure that you're not lying down. And that's just simply because this drug class can cause esophageal erosion. So that's something that we're trying to eliminate. So make sure you know this. So the answer choice is B. Take it on an empty stomach and do not lie down, or we say sit down because you want them upright. So sit down or lie down. So it just makes it easier if the patient just takes them a brief walk. Okay. All right, next. Miss Joy presents to the office with complaints of her 4-year-old daughter having a worsening cough over the past week. She states that her daughter attends daycare Monday through Friday. The nurse practitioner proceeds with the PPD placement. In 48 hours, the PPD insertion site is evaluated and noted to have a 10 millimeter induration. How should the nurse practitioner proceed? Now, the stem of the question states, how should the nurse practitioner proceed? Now, of course, this question could have a little bit more context as to why the nurse practitioner proceeded with a PPD, but roll with it. They had the PPD. The results are a 10 millimeter induration. So how should this nurse practitioner proceed? Okay. Take a moment, look at that, and then we'll go over that answer choice. Okay. What you got? Is it A, obtain the sputum culture and chest x-ray? B, nothing. A 10 millimeter induration is not a positive result for a child. C, explain to the mother that her daughter will need to stay home from daycare for 3 days. Or D, have the patient return in 2 weeks. So, okay, we're seeing how should the nurse practitioner proceed. Patient has a continued worsening cough. It's been going on for a week. We're assuming that the patient's mother told the NP maybe she had some contact or something that warranted the PPD placement. The patient is 4 years old and her results came back with a 10 millimeter induration. Now, you need to understand the indurations. The answer choice here will be A, to obtain a sputum culture and chest x-ray, because you know that's gold standard for the next phases when you are thinking of a potential positive PPD reading for tuberculosis, right? But you need to make sure that you are familiar with the induration. So what I like to go over in my review book in class is the different levels. So, 5 millimeter induration, 10 millimeter induration, and 15 millimeter induration. Now, common 15 millimeter induration, if we see that on anyone, that's considered a positive PPD and you want to proceed with the next steps. But let's go down a little bit more. 5 millimeter induration is just slightly indurated. And the population that you want to consider this for a potential positive are those immunocompromised patients, like your patients who may be on chemotherapy, your HIV patients, things of that nature. Also, people who have had recent exposure with someone who has been diagnosed with tuberculosis. 5 millimeter induration. You're thinking of that criteria, a class of people that you don't want to wait for any worsening symptoms, right? Next, that 10 millimeter category, which is here what we're talking about, because that's how this test result came back. That group of people are like travelers, people who have traveled within the last 5 years in those prevalent TB locations, commonly like those Mediterranean areas. Also highly populated areas like hospitals, prisons, daycares, etc., schools. And then also young children under the age of 5. Okay, so if you look at this, she has a 10 millimeter induration. She's 4, so that's under the age of 5. She's also in daycare Monday through Friday, so a highly populated area. So your answer choice here would be, again, is A, to obtain a sputum culture and chest x-ray, so we can further go through the process to identify what's going on here, since she has this positive PPD. Okay. All right, last question, number 3. States, Mr. Smith presents with complaints of shortness of breath. He has a history of COPD. The FEV1 is 62%, and the patient is currently taking albuterol PRN. What would be the next best action for the nurse practitioner to take? All right, read that stem of the question first, you guys. What would be the next best action for the nurse practitioner to take? Y'all take a few seconds to look over that. Tell me what you got, and then I'll go over it. All right. So again, stem of the question first. I always tell y'all to read the stem first, just so it slows you down. It allows you to look at the actual question to see and make sure that you are answering exactly what they're asking you, instead of us creating our own scenarios, right? So what would be the next best action for the nurse practitioner to take? This patient here is having shortness of breath. He has a history of COPD. His FEV1 is 62%, and then he's already taken albuterol as needed. Okay, so are we going to add Ventolin, add some Adderall, add Xopenex, or D, no changes required at this time, to have the patient to follow up? You can go ahead and eliminate D, because we need to do something here. But what does this tell you? So they have a history of COPD. And when we look at that FEV1, you want to be sure that you're able to identify the criteria of where they're following. What category would you put that in, right? So there's 4 stages of the COPD levels. I tell you to think of those ranges to help you retain it. So we have a mild stage, a moderate stage, severe stage, and a very severe stage of COPD, right? So the mild stage being one end of the range, and then the very severe being on the opposite scale. Because again, I tell you, when you have things like this, cluster it, think of it in a range, and then you can make everything else that falls in between a little bit easier, right? So the mild stage, the FEV1 is 80%, no greater than 80%, right? And then for the moderate stage, it's anywhere between 50 to 80%. Then the severe stage is anywhere between 50 and 30%. And then the very severe stage is less than 30%, right? Okay, so I say that to the mild, we're looking at that 80% range. Very severe is less than 30. The other two fall in between. That's why I like you to think about ranges. But here, this FEV1 is 62%. That falls in that category between 50 and 80%, right? So that's your moderate stage of COPD, stage 2. If you're having difficulty, I have a COPD video, go check that out. With the moderate stage, we treat with a SABA or SAMA, right? PRN, always having that rescue inhaler, which they already are on. That's your albuterol that is mentioned in the question. You also want to do a LABA or a LAMA, so you're long acting. If it's flu season, you want to give them a flu vaccine. So that flu season will be anywhere from October to March. It does not say that here, so we're not going to worry about the flu vaccine. And then pulmonary rehab, right? So during this stage where they're following in, the best answer choice next would be B, to add in that salmeterol, because that is your long-acting beta agonist, your LABA, okay? Because the Ventolin and the Xopenex, and this is why it is important to know your medicines and know what drug class they're in. The Ventolin and Xopenex are short-acting beta agonists. They're just like albuterol. Ventolin is, albuterol. So you could have easily eliminated those off the top, So you want to add in the salmeterol. The patient should also have pulmonary rehab too. And if it's anywhere from October to March, you want to have that flu vaccine too, since they're in that moderate phase. But based upon those answer choices, you want to make sure you add in that long-acting beta agonist, okay? All right, you guys, that's the questions for this week. Make sure you meet me back here next week for some more practice questions. Be sure to like, comment, and subscribe, and share with a friend or colleague who you think may find this helpful as well. Thank y'all. Bye.